Thank you for joining us for today's briefing, Advances in Psoriatic Disease Research. I'm Jason Harris, Vice President of Government Relations and Advocacy at the National Psoriasis Foundation. We are really excited. We have a great lineup of speakers for you, and I'll make this brief so we can get started. But overall, this is a really timely and important briefing to raise awareness of government research and public health programs related to psoriatic disease and other chronic illnesses. I want to thank all the speakers from our government leadership, Congressman Joyce, Congresswoman Debbie Wasserman Schultz as well. You'll hear a video from her in a second. And I also want to thank our advocacy staff, Sarah and Lucy, who really helped get everything together for this briefing. So without further ado, I'll kick it to Sarah to get us started.
Great, thanks, Jason. I'm Sarah Buchanan. I'm the Director of Federal Government Relations with the National Psoriasis Foundation. I want to echo our thanks to our sponsors for helping us put on this briefing, Representatives John Joyce and Debbie Wasserman Schultz. I'll run through the agenda real quick. After a word from our sponsors, we'll hear from Leah Howard, our NPF's President and CEO. Next, we'll dive into our presentations with Dr. Craig Thomas, the Director of the Division of Population Health within CDC's National Center for Chronic Disease Prevention and Health Promotion, followed by Dr. Lindsey Criswell, the Director of the NIH National Institute of Arthritis and Musculoskeletal Skin Diseases. Lastly, we'll open it up for Q&A, and we welcome all of you to submit questions via the Q&A box. And George Gondo, NPF's Director of Research, will join that panel to provide the community perspective. So without further ado, I'll pass it to Representative Joyce. Dr. Joyce is a dermatologist, and we are grateful he's using that experience to advance healthcare in his role in Congress. So thank you, Dr. Joyce.
Well, Sarah, thank you very much. I appreciate to be able to present to you all today. Just some brief background. I am a board certified dermatologist. I trained in internal medicine at Johns Hopkins Hospital in Baltimore. And then following that, I spent 3 additional years training in dermatology. So the issues of the National Psoriasis Foundation are my issues as well. I practiced for 25 years with my wife, who is also a dermatologist trained in the United States Navy. And we returned to our hometown in central Pennsylvania, where we practiced together. But after 25 years in that practice, an open seat occurred in the United States Congress. And none of the candidates who were running had in their top 5 agenda the ability or the interest in addressing healthcare. And so with a lot of deliberation and consultation with my business partner, my wife, I decided to run for United States Congress and bring the issues that you all face on a daily basis, bring those to Congress. I am fortunate to serve on the Energy and Commerce Committee and on the Subcommittee of Health, where a lot of legislation on healthcare goes and comes and is discussed, and it has to be to have an individual who understands psoriasis and psoriatic arthritis and the impact on that, not only on my patients, not only on my constituents, but on all the American constituents who face this on a daily basis. To be able to have that understanding and to be able to work not only on the Health Subcommittee of Energy Commerce, but as being one of the vice chairs of the Doctors Caucus in Congress, to be able to take your issues with that understanding of the impact of how that affects lives and livelihoods on a daily basis and to have those discussions. I've used my background as a practicing dermatologist who treated patients with a wide range of diseases, but specific to today's conversation, psoriasis, to support policies, innovation, and legislation that benefits the patients and their physicians. And that includes supporting legislation to prohibit insurers from inappropriately using step therapy policies to delay patient care and to delay patient access to care, to delay the patient's access to the medications that they need that have been assessed by the physician who they trust and the physician who is treating them. For example, I'm a proud co-sponsor of the Safe Step Act, which would apply some common sense guardrails to how step therapy protocols are used within federally funded plans. I don't think there's a clinician or anyone on this call who understands that step therapies are delay tactics, which ultimately impair a patient's ability to get the medicines they need, to get the medicine that will lead them back to productive lives. I applaud you for including this important piece of legislation in your agenda and I look forward to seeing this bill becoming law. On the same note, I'm supportive of policies to strengthen programs focused on psoriatic disease and specifically psoriatic research, including important work that the NPF is doing in which the CDC is supporting to ensure healthcare professionals are better educated about the multiple risks associated with psoriatic disease, including the risks associated with not appropriately treating the underlying psoriasis. As we continue to have these conversations, it's important to remember that chronic diseases like psoriasis, like psoriatic arthritis, are not partisan issues. Psoriasis does not delineate if you are a Democrat, a Republican, or an independent. So thank you for sharing this important insights that you bring into these discussions. And I take those forward to my colleagues, both on my side of the aisle and across the aisle. Again, thank you for all the work that you're doing, and thanks for being here today for this important discussion.
Great, thank you, Congressman. Next, we'll hear from Representative Debbie Wasserman Schultz.
Hello, I'm Congresswoman Debbie Wasserman Schultz, representing Florida's 23rd District in Washington, D.C. A special thank you to the National Psoriasis Foundation for their relentless drive to cure psoriatic disease and improve the lives of those affected. And I want to especially recognize Leah Howard, their president and CEO, who for the last 10 years has played an integral part in advancing patient and health advocacy. I've worked with Leah Howard for years to support the psoriatic disease community, and congratulations, Leah, for your recent appointment as CEO of the National Psoriasis Foundation. It goes without saying that this is well deserved. Thank you for joining us for this very important discussion about CDC and NIH activities on psoriatic disease. As you will learn in more detail from today's expert speakers, psoriasis is an immune-mediated disease that causes inflammation in the body. These conditions affect over 8 million Americans, including my own husband. I've seen firsthand how the development of novel therapies can drastically improve a patient's quality of life and ability to work. But these improvements depend on research, as well as public health factors like a person's ability to get diagnosed. 10 years ago, the CDC supported the public health agenda for psoriasis and psoriatic arthritis. Since then, organizations like the National Psoriasis Foundation responded to the call to action and launched initiatives aimed at improving education and awareness, as well as research to improve diagnostics. I'm thrilled to see the CDC once again picking up the baton on psoriatic disease through the Chronic Disease Education and Awareness Program, providing many resources to those affected by this disease. And I know that NIH is also continuing to do great work in this space through education, awareness, research, and clinical trials. But like with so many chronic diseases, more can and should always be done. For that reason, I have and will continue to fight for increasing funding and awareness for this disease, leveraging my position on the Appropriations Committee to make psoriasis a national priority. Thank you very much for your participation today. I look forward to hearing more about what our top scientists are doing for the psoriatic disease community, and thank our speakers for joining us today.
Great, thank you. And I will pass it.
I'm Congresswoman Debbie.
I will pass it to Leah Howard, our president and CEO. Thank you, Leah.
Thank you, Sarah. And thank you to our sponsors, Representatives Joyce and Wasserman Schultz, for those very kind opening remarks. I want to thank them for sponsoring this briefing and thank all of you for joining us today. I also want to echo the thanks of Jason to the staff who organized this really exciting conversation here this afternoon. I think you're all going to learn a great deal about the work happening in psoriatic disease and learn about some opportunities as well to get involved in what we're doing at the NPF. I want to echo the thanks of our sponsors to Dr. Thomas and Dr. Criswell for joining us here today. As you'll hear in their remarks, there's a lot of exciting work happening in psoriasis and psoriatic arthritis at the federal level, and I'm looking forward to listening with you to their remarks about the exciting new programs that are making a difference for people living with psoriatic disease. There are over 8 million individuals in the United States that live with psoriatic disease. And when we talk about psoriatic disease, we're talking about both psoriasis and psoriatic arthritis. And these diseases are chronic, inflammatory, immune-mediated diseases. And what many people don't know, in fact, is that if you live with psoriasis or psoriatic arthritis, you may also be at risk of developing a number of other comorbid conditions. There's about a dozen other chronic diseases that are connected to psoriasis and psoriatic arthritis, including diabetes, cardiovascular disease, as well as clinical depression. So the timing for this briefing couldn't be any better. This is a new chapter at the National Psoriasis Foundation, and thanks to the collaborative efforts of many of you on the line here, we've made amazing progress in recent years. Today, there's unprecedented government activity happening in the area of psoriatic disease research, as well as public health initiatives. And we're excited to hear more about those and how they are connecting new treatments with individuals living with psoriasis and psoriatic arthritis. Many people are probably familiar with how psoriasis presents on the skin as that kind of raised, flaky, scaly, almost rash-looking like effect on the skin. Although it does look different from person to person, given our different skin tones. But as I mentioned, many people are not aware of the connection between psoriasis and other chronic diseases. One of them is psoriatic arthritis. And about 1 in 3 people living with psoriasis may go on to develop psoriatic arthritis. So I'm going to pause here to share a video from a woman in our community named Shirley, who shares about her experience living with psoriasis and psoriatic arthritis.
I'm Shirley Wallace. I have psoriatic arthritis and I've had it for 31 years. A lot of people, even doctors, are amazed that I could live alone with a service dog and do everything that I do. I was 15 when I was diagnosed. It took probably about a year to finally get the diagnosis because psoriatic arthritis is very mysterious. It's very tricky. Out of the blue, my knuckles were turning black. They had to break my fingers open, and I had plastic knuckles. I lost a lot of my hair. It causes havoc with your joints, your muscles, everything. My father was with me, and the doctor said, she has psoriatic arthritis. She'll be in a wheelchair by the time she's 21. There's nothing we can do. My father was devastated with this diagnosis. I made him a promise that I would beat this disability. My father passed away when I was 21. And I just keep fighting it for him.
She just never ever said that, you know what, poor pitiful me. She just did it.
What can I do to get through this? She was never going to lose to it. She just kept going.
I do different strength training and I faithfully go a few times a week to physical therapy because where your joints are weak, it's going to affect your muscles and everything else. You have to fight it. Education is the tool. You have to know what you're up against, the symptoms, everything about it. I volunteer at Fairway Physical Therapy. A lot of people extend a helping hand to me through the years, whether it was for my disability or anything I may have needed. You lend a hand, you help people out for the goodness. To me, I do as much as I can in a day with this disability. I started extreme couponing, which I really enjoy. My boyfriend and I will go out for rides. We'll walk here or there. I take my service dog out. My boyfriend's name is Barry. It was love at first sight on his part. It took a while for me to get used to him. He's my rock. One of the many things my father taught me to do was to cook. So when they come back off the water, whether they're cold or what, they have a good meal to have. I enjoy cooking. I do. I mean, it's part of my life. You have to figure out what fits your hands. Obviously, being stubborn, I'm going to cook it. I was supposed to be in a wheelchair, and I'm like, I'm too busy. No matter how low you sink, and I've been there, don't give up. There's light at the end of the tunnel.
On behalf of the National Psoriasis Foundation, I want to thank Shirley for letting us share her story. I think Shirley's story really well captures the challenges of living with psoriasis and psoriatic arthritis. And she is the reason that the NPF is committed to pushing forward, finding a cure, and really making that health improvement for everyone living with psoriatic disease. The good news is that the patient community has great partners in the Centers for Disease Control and Prevention and the National Institutes of Health. The role of the CDC's public health workforce to improve health outcomes for individuals living with multiple chronic illnesses has really taken on renewed importance following the pandemic. As you know, many of the treatments available today would not have been possible but for the research taking place at the National Institutes of Health. So I am looking forward to joining with you and listening to today's speakers. So let's get started. I'll pass it first to Dr. Craig Thomas from the CDC.
Great. Thank you so much. Good afternoon, everyone. It's a pleasure to be here as Director of the Division of Population Health within the CDC's National Center for Chronic Disease Prevention and Health Promotion. Really appreciate the opportunity to speak with you in today's important briefing and discussion. CDC's, next slide, please. CDC's Division of Population Health resides in the National Center for Chronic Disease Prevention and Health Promotion. Our center focuses on helping people and communities prevent chronic diseases and promote health and well-being. The Division of Population Health provides national leadership, scientific expertise to prevent and control costly chronic conditions and diseases. We reduce health disparities and improve the health and well-being of the populations we serve across the lifespan. To achieve these goals, the division oversees a series of cross-cutting or cutting-edge programs that provide state-based and local-level data on chronic disease risk factors and outcomes, innovative data analytics for more granular data at the local level, and applied prevention research through the prevention research centers. We also promote implementation of population-based strategies that are evidence-based as well to address and improve the health outcomes within specific groups and settings. Examples include our Healthy Schools program, Healthy Tribes program, our Healthy Aging program, as well as our Alzheimer's disease, arthritis, epilepsy, and excessive alcohol use programs. And finally, we address emerging and evolving public health topics and priorities, such as the social determinants of health, mental health and depression, and chronic disease education and awareness. Next slide, please. Chronic diseases are conditions that last at least 1 year or more and require ongoing medical attention or limit the activities of daily living, or both. The Chronic Disease Education and Awareness Grant is a relatively new competitive funding mechanism designed to advance public awareness, education, and outreach on chronic diseases that are often lower prevalence, have limited awareness, and do not otherwise receive funding directly through a CDC appropriated line. This grant seeks to expand the role of public health in key areas, such as data collection, diagnosis, and treatment of chronic diseases like psoriatic arthritis or psoriasis that are not well known, but still have a significant impact on the public's health. Next slide, please. In fiscal year 2021, CDC released the first funding opportunity entitled Expanding the National Approach to Chronic Disease Education and Awareness. We refer to this, as we like our acronyms, as CDEA. So you'll hear me say that a few times today. The current grant is a 3-year funding period with requested funding up to $400,000 per awardee. In 2021, we awarded 4 grantees, and now with an increase in appropriation funding in 2022, we were able to add 2 additional grantees to the mix. Next slide, please. Funded recipients will expand their education and awareness of their identified chronic disease topic by implementing the following strategies: data dissemination activities that support awareness for public health professionals, but also data collection for the purposes of surveillance, epidemiologic research, and public health action. Education activities that support public health awareness, and of course, education activities that support health professionals with screening, referral, treatment, and management. These activities of our grantees reflect some common elements. Because the program is focused on chronic diseases that are not currently funded, the data on the burden of these diseases is less known. Therefore, collecting data on the burden of those diseases is the first step in telling that public health story. Whom, what, where, how much, and when can what can be done are key for the public health role, for defining the public health role and improving our efforts to address these chronic conditions. Second, CDC is a leader in data collection and surveillance. This is our bread and butter. Therefore, we also require or ask our grantees to consider what other information is available or needed about the populations and individuals that are affected by a particular condition, such as, are there issues with access to healthcare, ability to work, ability to care for oneself, caregiver needs, etc. Additional data can inform these strategies that might be considered to address and or identify these gaps and close those gaps over time. And finally, there is increasing awareness of the conditions through provider, patient, and community awareness and training. So programs that support the development, dissemination, and promotion of educational activities and materials are key. Next slide, please. So this is, there are actually several funded grantees, as I mentioned, that we are focusing on currently. We currently fund the American Academy of Sleep Medicine for obstructive sleep apnea, the Lymphatic Education and Research Network for lymphedema, the National Opinion Research Center, NORC, for hearing loss among adults, and of course, the National Psoriasis Foundation, NPF. Our newer grantees that are now effective were effective as of September 30th, 2022, include the American Lung Association for COPD, or obstructive pulmonary disease, and the Anne and Robert Lurie Children's Hospital of Chicago to address cystic fibrosis. Next slide, please. Some activities partners have completed, and this slide actually provides those highlights that partners have completed, include the American Academy of Sleep Medicine completed an initial draft of a sleep apnea national indicator report to promote awareness among public health professionals. The Lymphatic Education and Research Network successfully launched a lymphedema awareness campaign and secured spokespersons, Kathy Bates and Steve Gutenberg. And the National Opinion Research Center, NORC, created estimates of state and local level hearing loss prevalence by age categories, as well as by sex and race ethnicity. And the National Psoriasis Foundation released several podcasts and articles highlighting key issues for persons with psoriasis and developed new resources to support healthcare professionals' awareness and education of psoriatic disease. Our new grantees just received their awards last week, so I will highlight what they will be working on as well. The American Lung Association will focus on improving prevention, early diagnosis and treatment, and management of chronic obstructive pulmonary disease by engaging a network of strategic community partners to increase knowledge and adoption of evidence-based strategies that improve COPD mortality and morbidity across the US. And I mentioned the Anne and Robert Lurie Children's Hospital of Chicago will be focusing on overcoming current delays in initiating treatment for cystic fibrosis through dissemination of study findings and distribution of state-specific foundation patient registry data on care processes and patient outcomes to state newborn screening programs, personnel, and cystic fibrosis center directors. Next slide, please. So I'd like to take a moment to focus on one of our current grantees, the National Psoriasis Foundation. And it's a pleasure working with our partners in the National Psoriasis Foundation and appreciate their ongoing collaboration and support to address this important topic. The CDEA, or the Chronic Disease Education and Awareness Grant, provides a unique opportunity to combine efforts to address a number of these chronic conditions, including psoriatic arthritis. Psoriasis is an immune-mediated systemic inflammatory disease associated with considerable social and individual burden and increased rates of comorbidities, as you've heard earlier. Anyone can get psoriasis, but it mainly occurs in adults. But we are aware that children can also get psoriasis, and men and women seem to have it about equal risk for the disease. Many people who have psoriasis also have other health conditions such as diabetes, heart disease, and depression. And people can also develop psoriatic arthritis due to psoriasis, which is different from the other forms of arthritis that we treat and address. Since a large percentage of American adults have more than one chronic disease or condition, it's important to consider how self-management, both actually self-management and clinical management, can address the multiple needs of a population. By linking people that have chronic conditions or diseases and risk factors to community resources, CDC can help improve their quality of life, prevent or slow down the disease progression, avoid complications, and reduce healthcare costs and service utilization. Next slide, please. The National Psoriasis Foundation is raising awareness among public health professionals, healthcare providers, and the public about psoriasis and psoriatic disease. Educating and raising awareness about psoriasis is critical to expanding screening, care, and appropriate interventions to optimize patient outcomes, especially among communities of color, the LGBTQ community, rural communities, people living in low socioeconomic status, and those that are Medicare beneficiaries. In May, the National Psoriasis Foundation presented at the George Washington School of Medicine and Health Sciences at the George Washington Department of Dermatology, their third Learn to Derm Skin Health Fair in Washington, D.C. What's unique about this effort was that this education was provided to the Ward 7 and Ward 8 communities in D.C. on the importance of early detection of protection from skin cancer, common skin conditions, as well as when and how to seek care from a board-certified dermatologist. What's important about Wards 7 and 8 are those the poorest regions of our nation's capital, with a population that is primarily 90% Black and or African American, and they have very limited number of dermatological clinics in this area, what we call service deserts. There continues to be a striking disparity in burden among disease burden among these patients of color and patients among that who are low income. And there are also multiple conditions that these patients often have to face that go untreated due to lack of awareness or where to go for treatment and or services to have them cared for. And this negatively affects the impact of their quality of life. The National Psoriasis Foundation also plans to leverage partnerships across the National Association of Chronic Disease Directors, our main stakeholder at CDC within our center, also known as NACDD, to disseminate educational programs to chronic disease public health providers and professionals. Through this partnership, NPF identifies relevant content for public health professionals and will disseminate those educational materials and programming and resources about psoriasis and those comorbidities such as heart disease and depression through NACDD channels. Next slide, please. Thank you so much for having me here today. The Chronic Disease Education and Awareness Grant is an exciting new program that CDC administers, and it really offers us an opportunity to address the unmet public health needs in chronic illnesses such as psoriatic disease. CDC will continue to engage and work with our national partners as we look at various ways we can build greater capacity, understanding, and awareness of the evidence base, what works to address and advance the progress made on health conditions such as psoriatic disease. Thank you so much for your time today.
Great, thank you, Dr. Thomas. We'll pass it to Dr. Criswell, and I'll point out I already see a couple questions in the Q&A. Please feel free to type in your questions throughout these presentations, and we'll address them after Dr. Criswell's presentation. So Dr. Criswell, I'll pass it to you. Thank you.
So thank you. It's so nice to be here, everybody. I'm Dr. Lindsey Criswell. I'm the director of the National Institute of Arthritis and Musculoskeletal and Skin Diseases, or NIAMS, at the National Institutes of Health. It's a real pleasure to be here, and I greatly appreciate the opportunity to share highlights of psoriasis research at the NIH. And I'd like to thank Representatives Joyce and Wasserman Schultz for your leadership and all of you for your interest in this very important topic. And I would also like to thank the National Psoriasis Foundation for inviting me to participate. So on this slide, thank you, Lucy. I'll begin with a brief introduction to the NIH and NIAMS, and I'll start by clarifying that the NIH represents the federal government's commitment to biomedical research that will impact human health. Our mission is to pursue fundamental knowledge about the nature and behavior of living systems and the application of that knowledge to enhance health, lengthen life, and reduce illness and disability. In addition, we support and encourage the training of basic and clinical scientists to carry out this research. And finally, we disseminate information on research progress to ensure that the public is aware of the outcomes of their investments. Next slide. The NIH's support of basic research, in addition to translational research, which moves discoveries from the laboratory towards clinical testing in humans, and clinical research, is a fundamental value of the agency. Through these efforts, the NIH serves as an essential role in the larger biomedical research enterprise contributing critical knowledge as a building block. This information is applied to the development of future therapies through NIH support, as well as research conducted and supported by the private sector. Next slide. The NIH is composed of 27 institutes and centers that have specific disease and research missions, yet they work collaboratively towards the overarching goals of the NIH. Next slide. At Niams, we focus on research into the causes, treatment, and prevention of arthritis, musculoskeletal, and skin diseases, as well as training and dissemination, as I mentioned. Next slide. Given this focus, though, Niams serves as the home for psoriasis research within the NIH. In addition, though, because psoriasis affects many organ systems and different aspects of human health, as you've heard, we collaborate with many other institutes and centers with shared interests in this area, such as the National Heart, Lung, and Blood Institute, or NHLBI, the National Institute of Allergy and Infectious Diseases, or NIAID, and the National Center for Advancing Translational Sciences, or NCATS, among others. Often as a result of such collaborations, the NIH can bring together scientific teams for targeted research efforts. Next slide, please. But Niams is also committed to supporting the best of what we call investigator-initiated research. For these projects, the NIH does not specify the topic or disease area, but rather investigators send us their best ideas and we fund the most outstanding science. I'd now like to highlight a few examples of psoriasis research using both these approaches, starting with the research that's summarized on this slide. Niams has funded Centers of Research Translation, or CORTs, that bring together basic and clinical research in a way that helps translate fundamental discoveries into new drugs, treatments, and diagnostics. One of these courts is focused on psoriasis. The Psoriasis Court at Case Western Reserve University and University Hospitals Cleveland Medical Center supports an interdisciplinary team of psoriasis and computational researchers to assemble many types of data from individuals with psoriasis, including gene expression profiles from their skin and blood cells, the types of bacteria and fungi that populate their skin, and clinical features derived from their electronic medical records. They then compare such data against available large databases to identify molecular pathways that can be targeted by existing drugs that could be expeditiously moved to clinical trials. Next slide. Using a more basic approach, Niams-supported researchers recently found that a small signaling protein called TWEAK functions with TNF, that is tumor necrosis factor, and IL-17, or interleukin-17, two known and effective targets for psoriasis therapeutics. The potential of also targeting TWEAK might help address the issue of non-response or loss of response with existing biological therapies. Furthermore, a Niams-funded population-based study established a link between skin and joint inflammation and the risk of developing liver disease in patients with psoriasis and psoriatic arthritis. Next slide. Findings such as these highlight two important points about psoriasis. First is the critical need for more research, because despite dramatic effectiveness of many approved targeted drugs for psoriasis, not everyone responds. Loss of response is also frequent, and those with arthritis are more resistant to treatment. Second is the recognition that you've been hearing today of psoriasis as not simply a skin disease, but rather a whole body systemic autoimmune disease that appears on the skin. Next slide. With that in mind, I'd like to provide an update on the Accelerating Medicines Partnership, or AMP, which is a public-private partnership between the NIH, the FDA, industry, nonprofit groups, including the National Psoriasis Foundation, and other organizations. Over the last 8 years, the AMP program in rheumatoid arthritis and lupus has made unprecedented progress in understanding the cell populations, pathways, and potential novel drug targets that drive these diseases. Building upon this success, the Accelerating Medicines Partnership Autoimmune and Immune-Mediated Diseases, or AMP-AIM program, was launched last year. AMP-AIM extends beyond rheumatoid arthritis and lupus to include psoriasis, psoriatic arthritis, and Sjogren's disease. Next slide, please. As with AMP, rheumatoid arthritis, and lupus, collaboration and team science are key components of AMP-AIM. The program brings together multidisciplinary researchers and engages early career investigators to define the shared and unique immune mechanisms in these disorders, which will enable the development of new and effective therapies for people with autoimmune diseases. Importantly, AMP-AIM also serves as a model for addressing chronic disease more generally. In addition, the program aims to develop a knowledge portal that will facilitate rapid and efficient data sharing by the research community. Next slide. In March of this year, the NIH awarded grants to 9 research groups across the United States to establish the AMP-AIM network. One of these awards is Ellipsis, or Elucidating the Landscape of Immunoendotypes in Psoriatic Skin and Synovium. The research team is a coalition of dermatologists, rheumatologists, immunologists, and epidemiologists from the University of Rochester, University of Michigan, University of California, San Francisco, and the University of Pennsylvania. Participants in ELLIPS with varying stages of psoriatic disease will have biopsies of the skin and the joint synovium to determine which cells and pathways produce and promote psoriasis and psoriatic arthritis. Any patterns or pathways identified could have implications for a precision medicine approach for therapeutics. Next slide. So once again, I want to thank you for the opportunity to share my enthusiasm about psoriasis research, and we appreciate your support in our mission of turning discovery into health.
Great, thank you, Dr. Criswell. We will now start the Q&A section of our presentation. We do already have a few questions coming into the Q&A box, and we welcome all of our attendees to go ahead and type them in. But Dr. Thomas, I'll start with you. This first question is really about access to care and being able to afford a patient's medicine. That's not quite the topic for this panel, I know, but there are a lot of steps along the way to make sure that patients get diagnosed, or you mentioned earlier in your presentation, have access to providers, especially if they live in a provider desert. Would you be willing to go back over that information one more time and just lean in on, what are the activities at CDC, with your public health activities that really help patients with chronic illnesses, get from point A to point B? They're having symptoms and then now they're getting the care they need.
Sure, certainly. Thank you, and happy to do so. I was starting to type that in, Sarah, but it was getting too long, so it's probably easier to speak to that. I think one of the main contributions that public health, and in particular CDC, can make here is around the public awareness and education angle. It seems like a very generic approach, but it's very important for us to educate the community, our healthcare providers, and other service providers about the need to screen for, detect, treat, and care for those with psoriatic diseases. I am actually been in this field for over 25 years, and without data, we are unable to actually understand the prevalence of these conditions, let alone identify where these greatest disparities are. So the important step that we do in terms of activities are to first collect data for surveillance purposes, for conducting epidemiological research to understand the disease, and then of course to identify those treatment options that would work, at least from a population-based setting. Things like making sure that we can connect individuals within a community to the available resources and services that are in their area. And that's one major area that we like to focus on. And it's really that community clinical linkage that is key. It also then provides the community with more information and resources to treat and manage their disease, but most importantly, early diagnosis so that we can actually slow down the disease and or curb its impact on their quality of life. I think that's one of the main areas that we like to focus on, but it is a series of steps that we take, and building that evidence base for what works in this particular area to increase awareness and improve service utilization, treatment, of course, and diagnosis.
Great. Thank you, Dr. Thomas. And I know early diagnosis is really important to our community. We know that if a patient is delayed in getting diagnosed with psoriatic arthritis, and delayed in getting the care they need, it can drastically reduce their quality of life. So it's super important work. George, I'm going to pass it to you. Would love for you to introduce yourself, because I know you're the one working on the NPF's CDEA project. And then please go ahead and fill in some additional details here.
Yeah, sure. Thank you, Sarah. And before I get started, I just want to thank Dr. Criswell and Dr. Thomas for participating in today's congressional briefing, and Representatives Joyce and Wasserman Schultz for sponsoring this very important topic. Psoriasis affects millions of individuals in the United States, and it differentially impacts certain communities. And I saw one of the questions in the Q&A about initiatives for individuals with skin of color, and I will address that briefly. But want to just really highlight that in particular with psoriasis, the traditional approach and view of psoriasis has been that are presented to healthcare professionals when they're receiving their training is of fair skin. So how psoriasis presents on fair skin is different depending on differs from different skin tones. So if there's darker skin tones, it tends to be more purplish or brownish or just a discoloration. So when those healthcare providers see that traditional, more, the fair skin representation of psoriasis, they see red, and that's what they think. And that has a lot of implications for individuals with skin of color. We know that they have lower utilization of dermatological care, which can lead to lower utilization of appropriate treatments to manage their psoriasis, and then also impact their ability to be appropriately diagnosed and screened for psoriatic arthritis, and increases their likelihood of being misdiagnosed for other types of musculoskeletal diseases. So it's a huge impact. What is the National Psoriasis Foundation doing for this? Well, through the CDEA grant from the Centers for Disease Control and Prevention, we're able to offer a lot of healthcare professionals, a lot of training for healthcare professionals on appropriately diagnosing psoriasis and skin of color. We've had several in-person and virtual trainings on this topic. We have a webinar. We had a whole workshop around diagnosing psoriasis and skin of color for both dermatologists and rheumatologists. We've incorporated it into numerous trainings for nurse practitioners and physician assistants, and specifically our grant from the CDC has allowed us to continue a partnership with the Nurse Practitioners Association for Continuing Education, NPACE, which has allowed us to reach more than 500 nurse practitioners and physician assistants through just a handful of trainings. And that allows those very vital advanced practice healthcare providers and their ability to recognize psoriasis and skin of color. We're also educating patients, because I think that's very, very important to educate patients. We've created a whole resource center on our website with resources to help individuals understand what psoriasis looks like on different skin tones. And we're starting to create a library of different images so we can present what psoriasis looks like across the gamut of the rich diversity of individuals in the United States.
Great. Thank you, George. Our next question, Dr. Criswell, is related to the AMP-AIM program. And I know the psoriatic disease community was very excited when that program was expanded to include psoriatic disease. Would you be willing to touch on why that expansion happened and why it's so important?
Yes, well, first of all, I completely agree. This is a wonderful opportunity for individuals who are affected by psoriasis or psoriatic arthritis, the people who care for them, their friends and family members, and investigators. And it happened because there was a confluence of strong interest on the part of researchers, industry partners, which play a critical role in helping to support and extending the NIH dollars, and recognition that the timing scientifically was ideal, with the base of investigation through the Accelerating Medicines Partnership, the investment in rheumatoid arthritis and lupus, and recognition that discoveries there may have relevance to discoveries and may provide clues to pathways that can be targeted in psoriasis and psoriatic arthritis. The other conditions part of AMP-AIM provide an important opportunity to compare skin and lupus to skin and psoriasis, synovium in rheumatoid arthritis to synovium in psoriatic arthritis, to try to understand what are the commonalities across these diseases where we can leverage therapies that are effective in one condition for the other, and what are the unique cells and pathways. Further, through the initial iteration of the AMP program, very significant advances in technologies were developed and advanced that allow careful characterization of single cells. And that provides new opportunities for understanding diseases that apply those technologies. So we had investigators ready to go, an engaged patient community, voluntary organizations such as NPF, and industry partners who made this happen. So we're very fortunate, and I'm so excited for this community that they are involved.
That's great. Thank you. We're excited too. And that's one thing you notice from an advocacy perspective is we're always aligning with, patients with arthritis and other conditions. And we use a lot of the same treatments, I think, because there are a lot of shared similarities between these conditions. So thank you for that. Dr. Thomas, I'm just rolling down this Q&A box. I don't even have to share the ones I prepared, but I saw you already typing an answer here. How could additional public health activities help the psoriatic disease community? So you and George already provided a great overview of what's currently happening. I guess this question is, what's next?
I think what's next is really about understanding the data, as we are very excited about collecting some data now. It's been a few years since I think we've had the surveillance data that we need to really understand the progression of this disease, let alone identify the changing dynamics of this disease. It is one that obviously with the increase in population diversity, it starts to show up in different populations. We really want to be able to get in front of that. So that's why that data collection is so important, and we'll be using our national surveillance systems to collect those data. Those data will help us inform, one, where we can target the most valuable resources to those communities that are in greatest need. And that in turn will help us to advance our understanding of what strategies, I guess is the best way to describe it, work or most effective in getting individuals connected to treatment and care. At the same time, the complementing that work about, what doing that intervention work or implementation science work is just as important as the surveillance piece, because otherwise we aren't able to treat the problem. And one of the challenges is understanding what those underlying determinants might be, and addressing those determinants to receiving care, treatment, diagnosis, and those things such as lack of transportation or inability to access the internet. They seem like they're somewhat far removed, but actually they can truly impact directly the impact of the disease on these communities. So really understanding what are those barriers to getting access to care are going to be our focus next. And you're muted, Sarah.
Of course I am. Thank you for that. It wouldn't be a virtual briefing without.
Oh, no, yeah, something like that. Great.
At least once.
Yeah.
George, I wanted to invite you to weigh in or add any additional color from your perspective as well, because I've been trying to keep up with the great work that you're doing, and I understand you did do some work in, data collection, or at least trying to understand what else needs to be surveyed.
Yeah, absolutely. And that's something that, again, through the CDEA grant from CDC, we've been having a lot of discussion with our with an advisory committee of key opinion leaders and subject matter experts to think about what are the evidence gaps related to psoriasis, and how to best approach those within the surveillance capacity of CDC, whether it's looking at specific to psoriasis or looking at something that's more related to inflammation or maybe a symptom, something like itch, because it is very complicated to insert those questions into those surveillance efforts. Internally at CDC, at NPF, we've been looking at how we can use our own internal data collection systems to improve the evidence base for psoriasis and psoriatic arthritis, whether it's confirming what has been shown in clinical trials and through other clinical studies, and looking at real world evidence at the incidence of undiagnosed psoriatic arthritis, but also working with KOLs and subject matter experts to help validate and collect some real world data on emerging tools and assessment instruments to look at treatment satisfaction or to refine how we assess symptoms related to musculoskeletal discomfort to be able to better assess who might be at risk for developing psoriatic arthritis.
Great, thank you, George. And we do have some resources we can follow up with everyone, our attendees on this briefing as well, including resources about, even helping patients learn or try to ideate what are the right questions to ask during appointments to make sure they're fully taking advantage of that opportunity to see their provider. The next question is, what can I do to encourage legislators to learn more about the benefits of supporting research for psoriasis and other diseases? And as an advocacy staff personnel, I love that question. So I think the first half of the answer I'm going to give you is please sign up for the NPF's Advocacy Action Network, and I'd love to work with you. But Dr. Criswell, this actually dovetailed into a question I wanted to pass to you about patients getting involved in research. So my question was, what are the opportunities for patients to get involved in research, and when is it important, and why is it important?
Yeah, so a really important question, and I'm immediately reminded of the compelling video that was shared at the beginning of this presentation. So this is all about patients and those who care and love them. And increasingly, it's recognized that for healthcare research to be effective, it has to involve patients from day one, from the idea initiation phase, from the planning phase, from the participation phase, from the dissemination phase. If patients aren't engaged throughout that whole process, we don't have assurance that the research is going to be relevant, or we'll have problems with communication and understanding and lack of health literacy. So this is increasingly recognized as critically important. And one can observe the increased use of patient advisory groups, patients as partners in designing and evaluating the research. And I'm really pleased to see those trends. This is something that's been discussed in the context of the Accelerated Medicines Partnership, is how can this effort be positioned to ensure adequate patient engagement? So how can patients get involved? Certainly one avenue is through their providers. Many providers are aware of and participate in research. That's one of many opportunities. I can't underemphasize, though, the role of the voluntary organizations such as the National Psoriasis Foundation. It's critically important that patients, initially through their providers or through other routes, are connected with organizations that represent their interests. And the NPF and other organizations are in an excellent position to help identify research opportunities. I also want to point out that the NIH has a lot of information for patients. First of all, just basic educational material, and also clinical trials that are ongoing for specific conditions. So it's possible to go to the NIH and ask the question, are there any trials of psoriasis or psoriatic arthritis that are enrolling that I might be eligible for? So, and of course, I also want to mention some of the meetings that organizations such as NPF organize specifically for patients to hear about research and opportunities to get involved in research. So there are many avenues of participation, increasing recognition of its importance, critically a very important role of NPF.
Great, thank you. Appreciate that response. We agree with you. We definitely think, patients should be and often are at the center of research, and we appreciate NIH's commitment to that. Dr. Thomas, I'm not sure, I'm curious if you can answer this question. There's a question related to health education promotion in chronic diseases and investigation. So this person used to work as a nurse at the Indiana State Department of Health in the vaccine division as an investigator educator under a CDC grant. And she's curious if there's a similar grant to create something like that to help health education promotion in chronic diseases and investigation.
Okay, can you hear me now?
Yes.
Great question. And actually, as I mentioned, and I feel like I'm repeating myself, but I have to say it again, the expanding the science base and collecting the data obviously is step one here. But I think what is the person's asking about is there ever a state or a local program that receives funding directly from CDC to support something that's dedicated to addressing a disease such as psoriatic arthritis and or psoriasis? And the answer is yes, this happens all the time. The immunization program isn't in our center, but certainly it's one of the largest funded programs that CDC provides to the field. The majority of the funding that CDC receives goes out the door to state and local health departments, national partners, and local communities to address a range of public health diseases and risk factors. And in this case, we are still at the very early stages of developing a program for psoriasis. And that it means that we really do want to understand what the prevalence looks like, what is that evidence base for what works, what are the right partners to be engaging with at the state and local level. And of course, the bottom line is we need the funding dedicated to this particular disease in order for us to allocate funding in a grant or in a cooperative agreement to the field, who then in turn build the capacity within their agencies. So let's say it's a state program that would then build the capacity using those dollars to conduct and support a program similar to what you would see in immunizations. Immunization's been around for quite some time, so they're a very robust program area, whereas I think we are still at the very early stages of developing that public health approach for addressing psoriatic arthritis and psoriasis.
Great, thank you, Dr. Thomas. We have a couple minutes left, so I'm just going to keep rolling through these questions. George, I'll pass this one to you. How does a patient know when a provider really understands psoriasis and psoriatic arthritis? This person read the 2008 proceedings of GRAPPA. I'm going to put you on the spot. I don't know if you know the acronym for that.
Yeah.
I thought it was an Italian drink, but what they wanted to know.
Yeah, GRAPPA is the group for research on psoriasis and psoriatic arthritis. So GRAPPA does a lot of great work, and we work with them to help with some of their patient-centered research initiatives. It is always a difficult task for patients to assess how well their providers are giving them, providing care to them. Some ways and some tools that patients can use to help with this, can be provided through the NPF. We have a healthcare provider directory on our website where an individual can find somebody in their area who specializes in psoriasis and or psoriatic arthritis. There's a lot of different subtopics that they can search as well. So to the earlier question about diagnosing skin of color, if you're looking for a dermatologist or someone that can has some additional training in that and feels that they're very capable in that area, you can search for those types of providers with that experience. There's also some great tools through our patient navigation center to help patients prepare for an appointment. And that is something that's really, really important, is patients becoming educated and being aware. Again, patient advocacy organizations like the NPF are a critical role in that. And there's so many treatments out there. Healthcare can be so overwhelming for a patient that it's really important for them to be educated, to utilize those resources available to them and come into an appointment as prepared as possible.
Great, thank you. Well, this there's one more question I really wanted to address about systemic inflammation and how it with patients that living with psoriasis and psoriatic arthritis and how it impacts mental health. I know we're right at time. Dr. Criswell, if I could just have you touch on that for a little bit. I loved your diagram about, you know, a patient's body and about how these conditions are caused by systemic inflammation. And I think there's a theory within the research community that if you can address the underlying inflammation, you could also address some of those other symptoms they may be experiencing, like mental health conditions. And I just wanted to pass that to you and would be curious what you have to say.
Yeah, no, thank you. And increasingly, we're recognizing that many diseases that we don't even think have an inflammatory base have a fundamental inflammatory nature. And this speaks back to the benefit of the Accelerated Medicines Partnership, where we study a broad group of diseases together. In the case of systemic autoimmune diseases, there's no question that the systemic nature has profound effects on virtually all systems of the body, probably through multiple pathways, an effect of inflammation itself, an effect of the consequences of the disease, whether that be fatigue or a secondary depression that is expected in the context of a chronic immune disease. In the case of something like psoriasis and psoriatic arthritis, you can easily imagine how just the fact that you don't look like other people, you know, that's going to have a profound effect. And so by better treatment, you will minimize the systemic burden, minimize the inflammation, minimize the psychological effects, all of which should translate into improved cognitive, mental health, et cetera. And I think there are likely to be multiple pathways connecting psoriasis and psoriatic arthritis with mental health problems. And of course, there are effects of medications. If you're taking a corticosteroid or something else, that's going to affect your thinking and your cognitive function. So it's a very complicated topic that relates not only to psoriasis, but many other conditions. And so we can learn from studies of those other conditions that have systemic effects as well.
Yeah, thank you. I appreciate the way that you said that multiple pathways. That's a great point. Well, we'll end here. I really want to, oh, Dr. Thomas, did you have something to add?
Just that we are addressing the psychological reactions to psoriatic arthritis and or psoriasis, because clearly this is impacting one's ability to get out in public sometimes. And obviously that has a real deterioration on one's mental health and well-being. So one of those areas is social connectedness, which we think is one of the key areas where we can really address a number of chronic conditions, including things like epilepsy, lupus, where these are really critical diseases that impact a large portion of the population that have a mental health component. And what are those population-based strategies that we can implement to address things like depression? It may not even be a diagnosed depression. It could be just the anxiety of going out in public. And so that's where we think some of the strategies we're implementing to address that social isolation that comes with these diseases is going to be really important in the future.
Great. Thank you, Dr. Thomas. We will end here. I really want to thank all of our speakers, Dr. Thomas and Dr. Criswell and George. Thank you all so much. This was super informative for me. We will follow up with our attendees with some key resources that were discussed today. If any of you have additional questions that we can help with, please feel free to contact me. My email and my cell phone are on this slide. Again, really appreciate everyone joining us, and I hope you all have a wonderful afternoon.
Thank you.
Thank you, Sarah.
Thank you.